Our emergency responders are continuing to rescue people and rush aid to the mountains. The challenges are immense, but our joint response effort has and will continue to be massive. No matter who or where you are in Western North Carolina, if you need help, we are working around the clock to reach you. Yesterday, I talked with first responders and healthcare workers whose actions have been heroic, and I thanked volunteers who are helping in every way they can. We know that the devastation brought by Hurricane Helene is beyond belief. Communities were wiped off the map. Dozens of lives lost. Hundreds of roads remain damaged or impassable. Communication has been difficult due to cell phone and power outages. Many people were waiting for days trying to get in touch with loved ones, and thankfully many of them have, but some of them are still waiting. Access to water is difficult for many people. Across the region, more than 460,000 customers are without power, down from a peak of more than 1 million. More than 1,100 people are being housed in 29 shelters. We're working together to open more major routes to push supplies forward while repairing roads, utilities, and communications. I-40 East from Asheville is now open, and I-40 West into Asheville will be opening this morning. But we continue to ask people to stay off the roads in Western North Carolina unless travel is necessary. It's still dangerous on many roads, and your presence can impede rescue and recovery efforts that are underway. We're continuing to urge and help cell phone carriers to get cell phone service back up, and it's steadily returning. Utility companies are also working around the clock to get power back on. Yesterday, I went to the staging area in Asheville where our National Guard has been deploying to Western North Carolina counties hundreds of thousands of pounds of food, water, and other supplies. Those life-saving items are helping people across the entire region, including airlifts to communities that are not reachable by road. FEMA is working with us on the ground, in addition to other help. They've delivered about 1 million liters of water and more than 600,000 meals to North Carolina so far. The North Carolina Department of Transportation is working to reopen more roads, first by clearing debris and finding ways around major damage until repairs can be made. And we're grateful to the dozens of states and federal teams that have sent line workers, equipment, supplies, swiftwater rescue teams that, along with local, state, and National Guard, have rescued hundreds of people and many pets. I've briefed President Biden and Vice President Harris each on 2 occasions, and they have committed every resource available to this recovery. I appreciate the President's quick approval of our major disaster declaration this weekend and his direction that FEMA Administrator Deanne Criswell will continue to be here on the ground. She's here with us today. And now more than 57,000 North Carolinians have already applied for FEMA individual assistance, and they are already beginning to receive funds. To apply for FEMA assistance, go online to disasterassistance.gov, download the FEMA app, or call 1-800-621-3362. The telephone line is open every day, and help is available in most languages. I know many people are looking for ways to help. We activated the North Carolina Disaster Relief Fund managed by the United Way of North Carolina. Donations to this fund go directly to organizations providing relief on the ground. For more information or to make a donation, please visit nc.gov/donate. As heartbreaking as this damage has been, it's encouraging to see the way people are working together. I talked with a number of first responders and medical workers and volunteers who have left their own families to take care of our communities. Many of them had damage to their own homes. I'm deeply grateful for their sacrifice. That resilience and generous spirit will power much of this recovery. Today I'm joined by Emergency Management Director Will Ray, FEMA Administrator Deanne Criswell, Transportation Secretary Joey Hopkins, Major General Todd Hunt, the Adjutant General of the North Carolina National Guard, Colonel Freddie Johnson, Commander of the North Carolina State Highway Patrol, Attorney General Josh Stein, and the Secretary of the Department of Health and Human Services, Cody Kinsley. We also have our Department of Public Safety Secretary, Eddie Buffalo, here. Our American Sign Language interpreters are Karen Magoon and David Payne. And behind the scenes, our Spanish language interpreters are Erica Kugler and Tamara Cabrera. We'll first hear from Emergency Management, Will Ray.
Thank you, Governor Cooper, and good morning, everyone. The State Emergency Response Team, along with assistance from states across the country, the federal government, the private sector, community organizations, and nonprofits are working around the clock to respond to the needs of Western North Carolina. Commodities are being shipped by both road and by air. Rescue efforts are continuing, and we will continue those until everyone that needs our help is assisted. This disaster is unlike anything our state has ever experienced. North Carolina is strong and resilient, and we will get through this together. For North Carolinians that have been impacted and need financial assistance, please begin that process with application to FEMA Individual Assistance, as the governor said, by calling 1-800-621-3362. You can also apply by visiting disasterassistance.gov or by downloading the FEMA app. As the governor said, as of this morning, over 57,000 survivors have already applied for individual assistance, with over $1 million already being dispersed directly to them. I want to remind all North Carolinians that conditions on the ground remain extremely dangerous. Roadways are damaged, buildings are damaged or destroyed. There are downed power lines and unstable ground, with the risk for landslides continuing. We need to keep both ground routes and airspace free for first responders and public safety to work unimpeded to provide services and restoration. There's a tremendous aviation operation underway to continue rescue operations, to distribute commodities, and to ensure the swift movement of commodities into those communities. I want to remind everyone also to please refrain from flying drones in Western North Carolina. It is a hazard to aircraft flying as a part of the response effort. There are 28 county states of emergency and 58 municipal states of emergency that remain in place, with 25 shelters open with over 1,100 individuals being served. I wish to thank those working in our shelters to provide displaced North Carolinians with food, shelter, and access to resources. The work you are doing is critical to helping our residents. As of today, there have been hundreds of rescues made by our North Carolina search and rescue teams, the North Carolina National Guard, local first responders, and by search and rescue teams from many other states. If you need rescue or have an emergency, please call 911. For general disaster information, please visit ncdps.gov/Helene to keep phone lines open for those that need them. There are 22 states that have responded to help in North Carolina, with over 415 personnel on the ground, and that is increasing. We cannot thank you enough for your support. If it is not an emergency and you need to report someone missing, or if you are requesting a welfare check, please call 211, select your preferred language, and then push option 1. Thank you to the United Way and to the 211 operators who are working around the clock to process an unprecedented number of calls, as well as our North Carolina Community Emergency Response Teams who have volunteered to help with call taking and documentation. North Carolina 211 has received a significant number of calls from people concerned about their friends and family over the past several days, which are being logged to provide first responders with areas to search. Additionally, the American Red Cross has set up a reunification website for impacted southeastern states, which can be accessed by going to redcross.org. The North Carolina Office of EMS is working with impacted counties to ensure that both pre-hospital care and EMS systems are supported to provide life-saving emergency response. They have deployed EMS units, personnel, and are closely communicating with our hospitals and licensed care facilities to ensure that fragile medical populations are moved to safe locations and cared for. There are 2 state medical support shelters open to care for those that have been evacuated with acute medical needs in Western North Carolina. Additionally, 2 disaster medical assistance teams have been deployed into Western North Carolina to assist hospitals, and another is inbound to continue that support. I want to again thank the telecommunications professionals that have been working around the clock to restore cell phone service and mobile data to the mountains. We know there is more to do to improve access and coverage. For those in Western North Carolina, we ask that you turn your phones off and turn them back on periodically to allow the phone to connect to a network. I want to remind everyone that carbon monoxide is a concern when you are cooking on a grill or operating a generator for power during power outages. Please make sure you do these things away from your home, as carbon monoxide is a colorless and odorless killer. The North Carolina Office of State Fire Marshal has deployed 446 North Carolina firefighters with over 120 fire trucks to the mountains to assist the hardest hit communities. Thank you to the many fire departments statewide for answering our call for service. For general information, links to resources, and answers to frequently asked questions, please visit ncdps.gov/Helene. This website will continue to be updated with additional resources as we conclude the response phase of this disaster and begin to move into recovery. To learn more about how you can donate materials and supplies, visit ncvoad.org. Finally, I want to once again acknowledge those that have left their families and worked incredibly long hours in challenging conditions, responded to emergency calls for assistance, have staffed Emergency Operations Center and Incident Command posts across the state, as well as our critical healthcare facilities, to keep all North Carolinians safe. Thank you for what you do every day to protect the 10.8 million people that call this great state home. We are truly lucky to have such outstanding first responders and public safety professionals in North Carolina. This disaster is unlike anything our state has ever experienced. As we said at the beginning, North Carolina is strong and resilient, and we will get through this together. A note to our media partners listening. Unfortunately, our teleconferencing system is experiencing some technical difficulties this morning. For media listening in remotely, if you have questions about today's press conference, please email the Joint Information Center, and your question will be answered immediately following this press conference. Thank you.
Thank you, Director Ray. Now I'd like to ask FEMA Administrator Criswell to share an update.
Thank you, Governor, and good morning. Yesterday, the Governor and I had an opportunity to brief both the President and the Vice President, and I just want to share that their commitment to making sure all federal resources are available to support this response were articulated again and emphasized. And so I have committed to the Governor that I will stay here until the event is stabilized, and we will continue to bring in as many federal resources as are needed, not just for this ongoing response, but as we move into recovery. We have had resources here on the ground since well before the storm had impacts. We moved resources like our search and rescue teams and the Army Corps of Engineers. We have healthcare medical assessment teams, and now we have the medical assistance teams in the hospitals. And we have aviation assets and communication assets that we have brought in. We continue to bring in more resources as we identify additional needs, but also to anticipate what is going to be needed to sustain this level of operation for the days and the weeks to come. And so, Governor, you have my commitment to make sure that we continue to bring every resource available, that we think creatively about the type of resources that we have, and that we make sure that there's no delay and we eliminate any bureaucracy in trying to engage them into this flood flight as well as the recovery operations. And I just want to close by reiterating that you can apply for federal assistance. If you have had impacts to your home, if you have been displaced, if you have lost your food because of a power outage, but you don't have damages to your home, please register for assistance. You can again do that at disasterassistance.gov. You can download the FEMA app. You can call 1-800-621-FEMA. But we also know many people don't have communications right now. And so we are also sending our disaster survivor assistance teams into the shelters to begin with to help register individuals. They will begin to go into the neighborhoods as it's safe for them to walk around. If you see somebody in a FEMA shirt, ask them if you can register. It might be one of those teams, and if not, they'll be able to direct you to where you can. And so, Governor, again, you have my commitment from the entire federal family to ensure you have any resource you need to support this ongoing effort. Thank you.
It shows the magnitude of this disaster to have the head of FEMA here on the ground so long and that commitment from FEMA, so we're grateful for that. I'd now like to ask Major General Todd Hunt, the Adjutant General of the North Carolina National Guard, to share his report.
Thank you, Governor, and good morning. And I want to also thank the citizen soldiers that are out there and airmen with their dedication and service as we propagate through this crisis. I want to give you a couple updates on what the National Guard is doing. Right now, we still currently have 800 guardsmen on duty with 275 vehicles. Those numbers will increase throughout the day. We are running two simultaneously operations with our emergency management partners, with DOT and North Carolina State Highway Patrol. Those two operations are one by ground and one by air. Right now, our ground forces, or our soldiers on the ground, have pushed further into the western part of the state, and by this afternoon, we should have guardsmen in every affected county, along with a liaison officer in these counties to help with communications, commodity distribution, and getting a sense of what is actually going on due to some of the lines of communication have been broken. Our air operation continues to operate. Like the governor said yesterday, we delivered almost 200,000 pounds of food and commodities out of the Asheville airport. Right now, we're currently operating with 21 aircraft, and we have more on standby and some coming in this afternoon to help with this problem set that we have. I also would like to thank our civilian partners that are out there as well. Like I just mentioned, this is a team effort with emergency management, our highway patrol, our DOT, but most of all, thanks to the citizen soldiers that are out there every day. Some have not been home to their houses that have been damaged, and are helping others. So thank you, Governor.
Thank you, sir. I'd now like to ask our Transportation Secretary, Joey Hopkins, to share an update.
Thank you, Governor. As Governor Cooper mentioned, we were in western North Carolina yesterday, and we saw firsthand some of the devastation that they are experiencing out there. And our thoughts and prayers go out to all affected people. I want y'all to know that we're working day and night to remove trees and debris from the roads and highways. We have crews from across the state and contractors working just as hard as they can to do this. Unfortunately, some of our own employees are experiencing the same struggles as our citizens of western North Carolina. They have limited access or no access to food and water, and sometimes even fuel issues. We're sending supplies from other parts of the state so crews can continue to working on our roads, and we're working with other states to bring in other assets, such as temporary bridge materials, to assist in reopening damaged roads, and we're thankful for our partners in Florida for doing this for us. We've had many states reach out, our partners across the DOTs reach out and offer assistance. Right now, we have roughly 1,600 employees and over 75 contract crews directly assisting with these efforts, and more on the way. We have secured a location in Flat Rock to house up to 250 NCDOT and contract workers that are assisting these efforts, and we're hoping to move more people in as soon as we can increase housing. Due to communication and access issues, the ability to collect and even disseminate information about road closures has been hindered. We believe there are more road closures than are shown on the Drive NC website. However, that's the best information we have at this time. This morning, we're reporting 425 road closures, and we have already identified over 700 damaged sites. However, we're starting to see some progress on clearing, repairing, and even opening roads. Eastbound I-40 near Old Fort has now reopened, and we hope to reopen westbound I-40 in that same area today. I-26 is open throughout the state of North Carolina, and 421 is open to Boone and even past Boone toward the Tennessee line. However, we've got I-40 closed at mile marker 3 at the Tennessee line, and it will be for some time due to the extent of the damage. We're already looking at some options to stabilize the road that's left there, so hopefully we can start repairs just as soon as possible. At this time, we're still recommending a limit on travel in western North Carolina unless it's an emergency or you are assisting with recovery efforts. Travel in this area for non-emergency personnel is hindering needed emergency response. Also, I'd like to remind you, food, water, and even fuel is in short supply, so any additional needs on those resources hurts us too. We have issued emergency cellular alerts to motorists near the I-40, I-77 interchange, alerting them that travel is prohibited in western North Carolina and that we only want emergency or local traffic past that point. I do want to thank the Highway Patrol for manning that interchange for us during this closure. That was a huge effort, and I want to thank them for that. Our top priority is to open as many roads as we can so residents can get the supplies they need, and our utility partners can reach areas to repair their own infrastructure. I want to thank our many partners that are working along with our state to help alert motorists of dangerous road conditions and are also helping to clear trees and debris from the highways. There are many state partners that are helping in this effort. Some are like the North Carolina National Guard, the State Highway Patrol, local law enforcement, other first responders, and even private citizens are helping in those efforts. Our crews and staff are dedicated public servants and will remain working until the last road is reopened and travel is restored. This is one of the most catastrophic events, like has been said, that our state has ever seen or even that we've seen in our lives. Recovery will take time, and we appreciate your patience as we continue to assess and repair the roads and highways in western North Carolina. Thank you.
Thank you, sir. We'll now hear from our Health and Human Services Secretary, Cody Kinsley.
Thank you, Governor. The entire team at the North Carolina Department of Health and Human Services has made the health and well-being of Western North Carolinians our top priority. We are supplying and supporting healthcare facilities in the region, coordinating and staffing shelters across the state, and making it easier for people to get access to food and healthcare. There are 22 acute care hospitals in Western North Carolina. We have connected with every one of them to understand their power, water, food, medical supply, and staffing needs. As of this morning, 20 are on commercial power. The remaining 2 are on generator power. Many hospitals in the region are still on temporary water. We have activated 2 federal disaster medical assistance teams to help emergency departments at Mission Hospital and Blue Ridge Regional Hospital. With the large number of people that are showing up, we'll continue to support them with more support on the way. There are 91 nursing homes and 121 assisted living facilities in Western North Carolina. We have connected with each of them as well and are staying in close contact to ensure the safety and well-being of our elderly and disabled. Many of the facilities are still disconnected from commercial power and municipal water. We are supporting these facilities with the resources they need to support their patients and residents. We have supported 4 facilities in the region to transition patients and 3 more facilities in the region as well to other facilities in the state. For all healthcare facilities of every shape and size in the region, we are working with emergency management and the National Guard to use road and airdrops to get food, water, fuel, and other supplies to these facilities as quickly as possible. 6 water tankers and 4 large water storage units have been deployed to facilities, and over 190,000 pounds of food, water, and medical supplies have been delivered or airlifted to several locations, including critical healthcare facilities. We have activated statewide patient coordination and transfer systems using land and air assets to move critical patients to reduce pressure on Western facilities. Over 220 ambulances and 520 EMS personnel have been deployed to support patient movement. We know there is a significant need for oxygen in impacted communities. We have distributed 3 large shipments of oxygen and are working to secure more. We are also working to get oxygen available at centralized locations for individuals that are at home and oxygen dependent without power. Public health nurses have been deployed to help in shelters, and environmental specialists have been deployed to Western counties to conduct re-inspection so that flooded restaurants and hotels can reopen, and to assist with testing of private drinking water and wells to ensure that they are safe to operate. I want to remind people in Western North Carolina that drinking water may not be safe to drink from municipal sources or well water. Flooding damages infrastructure and wells with contaminants. Only use bottled, boiled, or treated water for drinking, cooking, and personal hygiene. We have 29 open shelters with over 1,000 people in those shelters. Those are being staffed through a combination of our state staff, county staff, and teams from the American Red Cross. We are working with the Department of Social Services in each county and public health offices in eastern North Carolina to identify additional volunteers to support Western shelters. We have 3 fixed sites delivering food to 30 different locations across Western NC. These deliveries are to shelters, fire departments, and churches throughout the region. We delivered 20,000 meals yesterday. We are working with our federal partners to automatically replace lost food for people who receive SNAP benefits and getting flexibility so that people with SNAP benefits can use those resources differently. We're also working with federal partners to temporarily provide food benefits to individuals and families that have been impacted who do not already receive SNAP. We have relaxed federal and state rules for healthcare facilities so that they can accept more patients when providing temporary shelter for evacuees from other facilities. Also, for people on Medicaid, you can now more easily get reimbursed for necessary services, get your prescriptions refilled early, and expedite nursing home admissions. We will continue to add more flexibility so that providers can act quickly and North Carolinians can get the health care they need. This storm has been catastrophic for so many North Carolinians. I and my team are committed to doing everything we can to help. There is real physical danger, and then there is an emotional toll as well from this storm. It is a traumatic event, and I want you to remember that there is no right or wrong way to feel at this time. If you need someone to talk to, call or text the Disaster Distress Helpline at 1-800-985-5990. Thank you.